Hello, my name is Matthias Schwab and I'm a PhD student at the Medical University of Innsbruck. And today I'm going to present to you our work that we did for the Unsure Workshop 2025, which is called Disagreement-Driven Uncertainty Quantification in Late Gadolinium Cardiac MRI. I will start with the motivation of our work. Myocardial infarction is a severe medical condition, and studying myocardial pathologies after infarction is critical to potentially improve the final clinical outcome. The current gold standard to assess pathologies within the myocardium is late gadolinium enhancement, also called LGE cardiac MRI. Due to the different washout kinetics that are illustrated in this figure here, the LGE is able to visualize infarcted tissue as well as areas with microvascular obstruction, which you can see in the image here. However, segmentation of LGE images can be very challenging, as the enhancement patterns of the LGE can be quite complex, and there are also severe class imbalances. Beyond segmentation, what's equally important is knowing how reliable a prediction is. That's why in this work we aim to not only do accurate segmentation of LGE images, but also develop a reliable method for uncertainty estimates. So here you can see an overview of our framework. We start with the original CMR stack and first do a slice-wise 2D segmentation of the images. Then we run an error-correcting 3D networks over to 2D segmentation and produce a 3D segmentation mask. After that, we investigate the disagreement between the 2D and 3D segmentations to do different kinds of uncertainty quantification. To our cascaded segmentation framework. This was published in a previous work, and if you're interested in it, you can look it up in the previous publication. However, the basic idea is to at first do a 2D segmentation and then trying to refine this 2D segmentation by training a 3D error-correcting 3D unit. During training, the 3D unit is enforced to detect and correct 2D segmentation errors by a newly developed perturbation module where we can slightly perturb the 2D segmentation masks. For the disagreement-driven uncertainty quantification, the general idea is to use the disagreement between the 2D and 3D models as a proxy for uncertainty. Hence, we define a soft correction score, which we call SCS, which is just summing up the differences between the probabilistic outputs of the 2D and the 3D networks. This is done across F runs when it's trained on F folds and C classes. Here you can see two examples of how the soft correction score is looking like. The original CMR image, the ground truth image, and the prediction, and the soft correction score is just a heat map highlighting areas where the networks disagree a lot, and hence there could be a lot of uncertainty within their predictions. To the results of our method, we evaluated the method on on a public dataset and on an in-house dataset, and we were able to investigate that first our cascaded framework is really doing some good segmentation accuracy, as we had the highest tie scores upon all the methods. Additionally, we were able to produce uncertainty estimates that were consistent with established methods like Monte Carlo Dropout, test time augmentation, or ensembles. Similar results we also had for the public dataset. Finally, in our work, we also wanted to be able to capture structured disagreements between 2D and 3D networks. To this end, we introduced a discrete correction map where we highlight bigger connected areas where the two networks disagreed. We also track between which two classes they disagree. Here you can see two examples. For example, in the lower part, you see in the pink area, the two networks disagreed if this area would belong to myocardial scar or microvascular obstruction. This could potentially be a lot of help for clinicians to understand areas where the networks are kind of not sure which pathology they are marking. To the conclusion, we developed a 2D, 3D cascaded framework for LGE CMR segmentation, and based on this 2D, 3D framework, we defined different uncertainty measures. One, the soft correction score, which is kind of giving a heat map of uncertainty, and second, a discrete correction map, which is able to visualize interpretable corrections for physicians. Our method achieves very accurate segmentation quality and also, in addition to it, produce reliable uncertainty maps. Finally, our framework is quite general and can be extended to other medical segmentation tasks in the future. Thank you for your attention.